Okay, we are going to set up the room for x-ray procedure. The room has already been wiped down, so she's going to come out and grab a barrier. This is for the second patient of the day. She's getting her barrier for the table, her barrier for the sensor, her barrier for the keyboard. And notice she grabbed them all at the same time so she doesn't have to go back and forth. Okay, we're going to put the barrier on the sensor. And then we're going to loop it back over the PID there. We don't want to put it back in the slot on the wall. We want to keep it clean because that's going to go into the patient's mouth. Now she's going to put the barrier on the keyboard. She's going to lay that over. And that's good for the mouse as well. So you see how it's covering the mouse? All right. Now we're going to put the barrier back here on the tray table. We want to put a barrier because our equipment or our XCP is going to be on this table. We don't want to drip saliva or anything down into the hoses here. So we're just going to cover that. Perfect. Now she's going to use the blue sticky tape. She's going to put one on the control panel. And then she's going to come out and put one on the x-ray button. Now she's going to fold over the corner just a little bit so that she can get it off easily later. There we go. Perfect. Okay, so she has all her barriers on. Now she's going to go get her supplies, which are right here on the table, her clean supplies, and a patient napkin. All right, on the tray table. Now she's ready for her patient. So she's gonna go grab her patient. Her patient comes in. Patient is seated. Now we need to put the lead apron on onto our patient to protect our patient. Lead apron. Now the lead apron is going to stay clean, okay? So to help with that process, we're going to put the patient napkin on the front. Got the patient napkin, and this is the one with the little sticky, so you just tear off the little tabs there, stick it on the front. All right, now we are ready to take x-rays. Okay, so she is going to, she already has her gown, her mask, and her glasses on, so that's fine. She hand hygiene, and now she's going to put gloves on. Now she could have done that whole process with no PPE on if she wanted to. She could don all of her PPE right now. So you can either set up with no PPE or you can set up with your gown, mask, and goggles. It's fine. All right, now we're going to take an x-ray. We worked on the patient. Took an x-ray. Now we're finished. So with our gloves on, she's going to remove the patient napkin. That goes in the trash. Her gloves are coming off because remember, our apron is clean. We're going to keep the lead apron clean. Gloves off. She's going to hand hygiene and then remove the lead apron. Goes back on the wall. And then her patient is going to come out. She's going to release her patient. Walks her patient out. They left. Now we come back. Now she's going to remove barriers. So she just hand hygiene. We're going to put on exam gloves because now we're going to remove the barriers and take our XCPs over to sterilization. All right, so she's going over. She's going to remove the barrier off the sensor, and she's going to leave it hanging there until we wipe it. We don't want to put it back in the slot yet. Removing the keyboard barrier over here. Then she's got a barrier on the control panel. She's going to grab that. See how she's kind of folding that up there? Perfect. And then the control panel barrier. She's got that one. On her way out, she's going to grab the one here. by the corner. So see how she didn't touch the wall? All right, now this has got to go all the way over to the contaminated area. All the way over to contaminated. Right there. She drops it, and then she removes her gloves from there. Hand hygiene. Comes back. And now she's going to put on her utility gloves because she's going to disinfect the room. And remember, there was no aerosol in here. We just did x-ray. So we're just going to do one wipe. Unless something odd happened. Unless the patient gagged really bad and threw up or had a lot of saliva everywhere, then we would have to clean and disinfect. So she's grabbing 2 wipes. She's going to start over with the sensor. So she's holding with one, wiping with the other. Down the cord. And now she can put it back in the holder. There we go. Now she's going to wipe the x-ray head. You're wiping everything because usually when you're taking x-rays, you're touching all that stuff. You can pull it out so you can reach. There we go. Perfect. So she doesn't have to wipe the control panel there because she had a barrier. She doesn't have to wipe this table because she had a barrier. Now she's going to wipe the chair. So the arms, the back, the head, everything. She's going to wipe the back because we didn't put a barrier there, not for x-ray. There we go. Perfect. Now with those wipes, that's her first wipe. She's going to clean her gloves. And then the last one to disinfect her gloves. So that's the setup and breakdown for x-ray. Remember, this apron remains clean.